Okay, the next area of hip flexibility we're going to look at is the hamstrings. This test is bringing the leg up. So I'm going to have Ella stay really relaxed. I'm going to take the full weight of her leg in my hand. I'm going to watch her face, make sure she's comfortable. I'm going to have her tell me when she feels a stretch in the back of her leg. Ella's fairly flexible, so we're able to get pretty high. You still feel good? Yeah? So once you get to 90 degrees, that's a negative test. You need 90 degrees of hip flexion with your knee straight to do most of our forward folds. However, if you had a positive result, this is what you might see. As you're raising the leg up and you're monitoring your student, making sure the hip doesn't lift up, you would see their face maybe cringe a little bit, and if you ask them, do you feel a stretch, they might say yes. At that point, you're noticing a lot of resistance to your lifting the leg, and that would mean that's a positive test. One thing to be really mindful of is this is also a test for disc herniation. So if as you're lifting the leg, and especially if you pull the toes back, your student complains of shooting pain down their leg, that's a sign that you need to refer them to a physician for assessment. So take a moment and practice doing this hamstring flexibility test. Now we're looking at shoulder flexibility. This is another test that has several different components to it. The first thing I'm going to do is have Ella bring her arms overhead. So go ahead, Ella, and bring her arms all the way overhead. Beautiful. So what we're looking at is, are her biceps by her ears and are her arms fairly close to the floor, around 180 degrees of shoulder flexion. We're also noticing, did she arch her back a whole lot? We already know from our previous assessments that Ella has a little bit of a weak link here. So I'm going to have her bring her arms down. What that means is if her back arched more when she brought her arms overhead, that may indicate poor core stability. I'm going to see if that's something that's going on. I'm going to have Ella engage her core really strongly. Go ahead and bring your arms back overhead. I'm looking to see if her back moves. And she did a great job at keeping her core stable as her arms went overhead. So for Ella, that's a beautiful negative test. Let's go ahead and bring your arms back. Now we're going to look at what we might see as a positive test. One thing we might see is as she brings her arms overhead, her back arches a lot. Notice that movement? That would mean that she might have poor core stability, and we're going to have her repeat it and see if she can maintain that with her arms overhead. Go ahead and bring your arms down. This time, we're going to have her bring her arms overhead, but they're not going to reach by her ears. So as you bring your arms overhead, stop right there. You can go a little bit further. Yeah, so this person would have a positive test for decreased shoulder flexibility because you would see a big space between the floor and her arm. So you would note that as a positive test. You can go ahead and bring your arms down. Go ahead and try